same question right now. How do we resume operations as productively as possible while protecting workers as effectively as possible in the age of COVID-19? Now, to be clear, this is really about risk mitigation, not risk elimination. We can't account for or prepare for every eventuality, and so we're taking steps to mitigate risk, but there are no steps that would completely prevent risk of transmission for our workers or for our customers. So what are the basics of a mitigation effort, and how do you implement a program? Well, we designed the Return to Work Safe at Work program to address all aspects of a successful mitigation strategy, and there are really 7 pillars of the program. The first, protect workers and customers and prevent infection spread. Second, identify the sick and infected workers early. Third, segregate the sick from the well. Fourth, assess sick workers for COVID and other illnesses. Fifth, test those with COVID-related symptoms quickly. Sixth, treat the patients under the care of a physician and with guidance specific to the illness, risk, and situational factors for that worker. Remember, most of these illnesses are not COVID, but require prompt care and treatment nonetheless. Right now, we're seeing a surge in cases, as I think you all are aware, in Metro Atlanta. But the incidence rate or the positivity rate of our testing is less than 10%. That means that 90% of folks presenting with symptoms of coronavirus don't have coronavirus. They have other infectious disease. We do anticipate that positive rate will increase over the coming weeks, as we are definitely seeing quite a surge in symptomatic patients. And then the 7th pillar is to return those employers who are sick and do have coronavirus safely back to work as quickly as possible. Next slide. So Piedmont Urgent Care offers a customized menu of services to address all aspects of mitigation, while relieving that burden and even potential liability from the employer. Next slide. So the first pillar of mitigation is to protect and prevent. And one such example of this is the use of PPE in the workplace. I know you've heard this ad nauseum. I'll just go through one example because I think it's just very telling and debunks some of the myths around PPE and certainly around face masks. We recommend face masks for all employees and when possible for customers as well, and here's why. If a COVID carrier who isn't wearing a mask comes into direct contact with an uninfected person wearing a mask, the transmission probability approaches 70%. We also know that that COVID carrier could be asymptomatic and not know that they're sick and carrying coronavirus. So it is extremely important, as you can see, that we prevent this type of contact and transmission. If that COVID carrier is wearing a mask and comes into contact with an uninfected person who is not wearing a mask, say a customer, the transmission probability decreases to 5%. That is a tremendous impact on face masks for workers and, of course, where possible, customers. If both the COVID carrier and the uninfected person are wearing masks, the transmission rate decreases to 1.5%. Bottom line is requiring everyone to wear a mask or face covering makes sense and is extremely effective as a way to mitigate transmission risk. Next slide. Other environmental and infection controls further reduce the risk of spread. I've given some examples here. These are all familiar to you. It's important to note that all the infection control measures that we're recommending for COVID are equally effective for other infectious diseases and are likely to create a secondary benefit in workplaces by reducing the spread of other illnesses and potentially reducing absenteeism. Next slide. The second pillar of mitigation is to identify. We offer different ways to screen and test employees depending on your needs. We do have mass testing programs available for reopenings and periodic surveillance or exposures. And we also have diagnostic PCR testing for individual workers who are symptomatic or have had an exposure. Next slide. As you all know, CDC recently released reopening guidance for businesses, and while there is specific detailed guidance that varies by industry, the core steps to reopen and maintain safe operations are essentially the same for everyone. I'd like to highlight how we assist with one of these in particular. Next slide. So the CDC considers ongoing monitoring and illness management to be central to safe business operation through the pandemic. For ongoing monitoring, the CDC urges protocols for screening workers for symptoms of COVID daily before they start their shift. The CDC also recommends that those who are sick should stay at home and that a plan of action for those sick workers be clearly established and their return to work be managed with the guidance of a healthcare professional. Next slide. So we can help you initiate a screening and illness management program to meet these CDC requirements in one of a couple of ways. We can have train and have your staff do the on-site screens, temperature checks and symptom screens, or we can give you tools to help employees screen and manage symptoms of COVID from home prior to coming into work at all. Next slide. For on-site screening programs, we recommend a combination of fever screens and symptom checks to optimize identification of COVID illness in the workplace. With basic training and protocols, this can be done by non-healthcare people as long as your next steps for positive screens are clearly communicated. Next slide. We can share QR codes with you that positive screens can use to launch a virtual visit with one of our Piedmont Urgent Care providers. At that visit, an illness assessment, initial treatment, and testing decisions are made, and those with suspected or possible COVID will be scheduled for testing at one of our locations and asked to self-quarantine. If the test is negative, then the patient can usually return to work and receive treatment for other causes, such as strep throat or sinus infections, etc. If the test is positive, then COVID care and guidance will be given, and the provider will reassess for return to work using the symptom-based approach or testing approach recommended by the CDC, which I'll detail in a little bit. Next slide. Here's an example of a QR code card that can be given to those who screen positive for on-site screens. Folks would then use their smartphone camera to link through the QR code directly to the virtual visit platform. Next slide. So we can also help you set up pre-shift at-home employee screening using our COVID symptom bot. At-home screening with our symptom bot is an easy-to-use and integrated solution. This method is consistent with CDC reopening guidelines and screening criteria and is intended to be a smart algorithm that quickly identifies those with major symptoms that should be tested, but doesn't screen positive too many of those who have just one minor symptom. And I'll demonstrate that in a minute. They'll get an email with confirmation of their screening results. That's sent to the employee, can be shared with the employer. Positive screens can be linked directly with a Piedmont Urgent Care virtual visit for assessment, testing, and treatment decisions, like I previously mentioned. And this tool really helps minimize the delays and inconsistencies with illness management and return to work determinations that plague a less integrated approach. So Brittany, if you could link on the Summit Urgent Care, and I'll take this opportunity, let's just make sure that this gets up on your screen. Great. So Piedmont Urgent Care recently merged with Summit Urgent Care. Summit Urgent Care has 9 centers along the Southern Crescent from Peachtree City to Fayetteville, to Noonan, LaGrange, Carrollton, etc. So many of you are already familiar with Summit. They've been around for, boy, I think almost 20 years. Tremendous reputation in the communities that they serve. Really a strong urgent care operator. We merged with them at the end of last year. We're going through a rebranding effort this year that's been a little bit delayed, as you can imagine, by our response to COVID. But nonetheless, Summit Urgent Care is part of Piedmont Urgent Care. We're still integrating websites and brands and all sorts of and electronic medical records. So they're still operating a little bit separately. They have a separate website. They have a separate access point to their virtual visit platform, separate symptom bot, etc. So I mentioned that just so that you know that both are an option. Certainly for Henry County, both Piedmont Urgent Care branded centers and Summit Urgent Care branded centers, as well as their virtual platforms, are available to your employees as they need them. So here's an example of the symptom bot. It looks exactly the same for the Piedmont Urgent Care symptom bot. So the employee enters their name and does this pre-shift. We can add your organization to this drop-down list so that you're getting automatic reporting, or they can just choose other and enter the employer here, just for tracking purposes. And then of course they can enter their email so that they get the results of their screen sent to them. They can choose to then forward that to their employer, say their HR director or occupational health director. And they can even include the HR director's email if that's how you all would like them to report. So this is really customizable based on how you want your employees to do it, so that you're getting the information on their screen. You will essentially get whether they screened positive or negative. We're not sharing additional personal health information, although the EEOC does allow for us to, or for employers to have some information on these screening symptoms. But if you get that information, you are responsible for maintaining the confidentiality of that information. So we prefer, first of all, that we don't think it's necessary. The screening bot identifies those who are at risk and should be staying at home and getting screened. And I think just keeping track of how many people are screening positive, just with that positive result is probably enough for you all. So the way the bot works is if you have a major symptom like fever, go ahead and click that, scroll down, and that's all that you have. You submit that, and of course that's a positive screen. If you could go back one, Brittany, before we launch the virtual visit. So unclick fever, and let's just say you have muscle pain. That's a minor symptom. And if that's the only symptom you have, maybe you went for a jog yesterday for the first time in a while, go ahead and submit. That's a negative screen. So go back. So we've used the CDC guidance to help direct this, and as well as some common sense. Obviously, we want folks who've had direct contact with someone confirmed with COVID infection to get tested, and that's consistent with CDC guidelines. New loss of taste or smell happens to be one of the earliest symptoms that a lot of folks get, and we would not want those folks going back to work because that's a pretty specific symptom consistent with COVID. So go ahead and submit this one. You can launch the virtual visit directly from your positive screen. And this takes you to the queue. Now you'll notice that their online visits are full for today, open starting tomorrow. I'll take this opportunity to let you all know we are seeing an unprecedented demand for testing and virtual visits. Nothing like we've seen to date. This is consistent with the surge of cases in Georgia and certainly Metro Atlanta. It's consistent with many employers wanting workers for return to work testing, to get return to work testing. And so our online visit platform has been inundated and our testing services have been inundated. All the testing sites are seeing more demand than they can keep up with. It's unfortunate. We are working through solutions to try to unclog that at Piedmont Urgent Care for sure, and at Summit, but those challenges are real. So that will cause some delays. We are also seeing some delays from the labs, and we are working through that very quickly. We just secured instruments and for rapid testing, which we're very excited about. We should get rapid testing accessibility as early as a couple of weeks from now. So that's another solution that will help us kind of dig out of this. But we do have limited access right now to our virtual visit platform. I encourage you, if you're concerned about launching the Symptom Bot program until things clear up a little bit on the virtual visits, that's fine. Check in regularly through the Summit Urgent Care website or the Piedmont Urgent Care website. You'll be able to link directly to this queue and see how we're doing in terms of availability. All right, so let's go back to the presentation. I'll add real quickly that our virtual visits are open from 6 a.m. to 10 p.m. 7 days a week. So they're open for even longer hours than our facilities are. Next slide. So here's the detail for return to work determinations I mentioned earlier, using the symptom-based and test-based methods recommended by the CDC. I'm not going to go through each one of these. But again, this testing delay is making it very difficult for us to, get these folks tested early and get them returned to work as quickly as possible. But like I said, we're working through that as much as we possibly can. Next slide. So what makes us different? Importantly, we are a physician-led model of care that manages the sick employee through the continuum of assess, test, treat, and return to work. We believe that test-only strategies are dangerous, create confusion, burden, and liability. Remember, most of these illnesses will not even be COVID, but these folks should still have an evaluation and treatment by a medical professional. A negative COVID test is only part of the story. Also, a positive test is only part of the story. These folks can be very sick, and it really should be in collaboration with and through an assessment by a physician to determine what's the best disposition or where should that patient go. Can they safely treat themselves at home? Do they need some additional medications or should they go to the ER? We also, of course, guide them on what should trigger things like that. So very important. We believe it's very important anyway that you have a physician-led model of care. Secondly, we don't outsource or contract with telemedicine providers. Our patients are cared for by Piedmont clinic providers. The telemedicine interface we use is very user-friendly, full of automated tech, and our patients are attended by our staff all the way through the visit. So they're not just kind of sitting around waiting without hearing from folks. We're not a mass testing site at the county fairgrounds, and while we are experiencing some delays and some challenges, no question about it, once people get scheduled for their test and they're assigned, that's on a schedule, so we control that. They're spending an average of 5 minutes to get their test. It's the testing, the drive-through testing is still running smoothly. They're not waiting in lines all day. We're not taking people first come, first serve. They have to be scheduled. So while There are some delays right now in getting that process done through the virtual visits, and not terrible delays, but certainly some delays. We think it's just more user-friendly to be able to know your time slot, show up, get your test, and get out of there, as opposed to not knowing if you're going to be sitting in your car waiting in line for 8 hours. And finally, we have, actually, just if you could go back one, not quite ready yet. There you go. Finally, we have streamlined, easy to distribute tools that make it easy for employers to implement the illness management solutions recommended by the CDC. And we demonstrated one of those in the Symptom Bot. Next slide. So just a reminder that we still have 27 locations in Metro Atlanta to serve all of your urgent care and occupational medicine needs. Injury care, imaging, and other services are safely treated in the center, and all staff and patients wear masks, along with vigorous infection controls that have been implemented to keep those facilities safe. You can have employees show up at a facility and not use the virtual visit platform. We are working to get those folks tested when they present, but that is a new workflow for us, and I don't want to overpromise on it. Be happy to give Gary an update in the coming days and weeks as that process smooths out, where folks can actually just show up, even if they're sick, show up and get tested, usually curbside, so that they don't have to wait for an open slot on the virtual visit queue. Next slide. So here's some examples of collateral that we use and can share with you, that you can share with your employees regarding the Symptom Bot. Here's one example from Summit Urgent Care, another example from Piedmont Urgent Care. These can be business cards, note cards. We have magnets for the Symptom Bot. All these are available to you if you're interested. Brittany would be your source for that. Brittany also has a sales team that can support her in case you need additional information or follow-up. Next slide. So this slide summarizes our return to work services presented today, and I've included some contact information here, and Brittany is your main point of contact, and then can kind of triage your question to the right person. And just want to say we look forward to serving you and your employees as we get back to business. Do appreciate your patience as we work through these recent challenges with surges and testing capacity. It's unfortunate. We all feel unfortunate to be in this situation, not in control of all of it, but certainly working hard to solve the matters that we can and provide fast, efficient access for your groups. Thank you all.
Thank you, Dr. Resnick. Appreciate that. There was a lot of great information. We do have a little bit of time if anybody has any questions. There's a Q&A feature that you can ask questions, or you can type them in the chat as well. Brittany, if you would you type your email address in the chat right quick, so if anybody wants that, they can have it. Or you can also email me with any questions if you have anything that comes up. And I will be glad to forward that on to Brittany as well.
And Gary,
we also, yes, sir.
You were going to share that slide deck through a PDF.
Exactly. Yeah, I was about to say, as soon as we have this recording, we'll have it up on our resource page, and we'll add the slide deck to that as well, so people can access it through our resource page. So that is all we have. Like I said, if we have any questions come up, I'll be glad to forward those to you, Brittany, and then you can follow up with anybody that has any questions. Thank you again for all the information, and hopefully we'll get over this crisis sooner than later. But glad to have Piedmont Urgent Care helping us with this as we're going through it.
You bet.
So I don't see any questions right now. So just want to say thank y'all for your time, and thank you everyone for attending. And we will end right here.
Thank you.
All right, thanks.